Welcome, class. This is a relatively short chapter in the book, but great stuff. We're gonna talk today about causes of mortality and morbidity, why people seek out healthcare, what are the greatest drains on the healthcare system. And unlike some other lectures, a lecture like this doesn't age well. If I recorded in 2021, the number one cause of mortality is COVID-19. So things do change. You'll see it's a slow process. We'll see the 70% of deaths are caused by just a few things: heart disease, cancer, and respiratory diseases. So let's get right into it. And this mosquito reminds me that when we talk about disease and mortality, it depends where in the world you are. We're going to talk about the US. Is it Maine? Is it worldwide? And it makes a big difference. Malaria is a huge killer worldwide, but not so much in the United States. All right, so mortality is pretty straightforward. Death. Well, I guess you can define death. Is it brain activity? Is it the heart stopping? But person is dead. I guess we can all pretty much agree on that. So mortality. And really, when someone says, "Oh, are you dying?" Oh, they're dying. Well, we're all dying. You are dying. It's just a matter of time, when it's going to be. But all of us, our bodies will end. I don't depend on your philosophy what happens, in the afterlife. But we're all dying. We're all going to die, and possibly our genes will be, carried on, or possibly not. All right. Morbidity is another term you need to know, and it's cause of sickness, or we're talking about disability. And again, this term, does it mean you're in a wheelchair or crutches? There's mental disability? There's a lot of things here, but we'll look at morbidity, and then mortality that's easier to define. And again, these terms, an acute disease comes about very rapidly: a broken bone, appendicitis, a cold, that kind of thing. Chronic diseases last a long time: cancer, Alzheimer's, diabetes. So they're quite different. We talk about acute pain and chronic pain as well. Acute pain is, you can pinpoint it. It's sharp. Usually has biological significance, saying, this, you got stabbed here, you broke this bone. And chronic pain, sometimes cancer pain, other kinds of pain that can lead to depression and can be more of a throbbing long-term pain. But when you think about acute, quickly, and then chronic, longer. And aging, you could talk about the number one disease, killer of people, because there's a expiration date on life. If you're a hamster, it's a couple years. If you're a human, 115 or 120, something like that. And no one has gone beyond that. All right. So causes of death, mortality. I mean, in the US, it's really straightforward, because all deaths, just legally, you need to have a medical professional determine the cause of death and put it on a death certificate. These things are all public record. And so mortality and their causes, although there can be mistakes, but it's pretty good data that we have there. And indeed, you should know 5 most frequent causes make up 70% of deaths. So, that weird accident or this unusual disease make up just a fraction. Most people, heart disease, cancer, COPD, things like that. And mortality really depends on your age too. We'll see early on more accidents, sports injuries, or it will be more at a certain younger age as compared to geriatrics, and a lot of diseases catch up to you in older age. All right, we can take a look here at what we got in the book. So again, the date's a little dated, but it hasn't shifted that much. But look, heart disease, chronic congestive heart failure, myocardial infarctions or heart attacks, usually caused by atherosclerosis, where you get hardening of the arteries, narrowing of the arteries, clots formed, and clot will block a coronary artery, one of the branches, and cause damage to the heart. Cancers, we believe those are going to maybe take over heart disease in the near future. And then chronic pulmonary diseases, emphysema. A lot of these are caused by smoking, not all, right there. And then accidents. Most of those are vehicle accidents, talking about the US here. It's even, I think the book mentions, it talks about maybe 50% of those alcohols involved as well. So accidents of many kinds, but our vehicles are our main issue. Strokes, and again, they're called a cerebral vascular accident, a CVA, a stroke. Two kinds, guys remember, is you could have an ischemic is where you have a clot that blocks one of the arteries going to the brain. And then that's the most common, some 85%. And then the rest is a hemorrhagic, where you have a bleed in the brain. Usually it's an aneurysm or a ballooning of an artery, and then high blood pressure bursts it. So you can have a bleed or a stoppage of blood flow. In either case, that very hungry brain tissue is going to die. And again, you all should know, symptom of a stroke, you'll see it's usually one side or the other. So usually speech is affected, and maybe the right or left arm is affected, or that side of the face. Because your brain, remember, the left side controls the right the left. And so a stroke will be in a particular place and it will affect half the body. And again, just so important to know, if you notice this slurring of speech kind of suddenly onset, and this half the body appears to be limp, time is of the essence. Just get to the doctor, get to the hospital, and they'll see what kind of stroke it is and give you clot busting drugs, or go in there, and do the necessary surgery to fix a bleed. Okay. And look, Alzheimer's, this has really come up, hasn't it? Diabetes, diabetes itself, and maybe I'm talking to diabetics, you can control it, but over time, if it's not controlled, blood vessels get damaged, and those blood vessels cause blindness, kidneys, that just lack of blood flow to various organs. So that's the cause of death here, not diabetes. High blood sugar by itself, it's usually these other effects. Yeah, and of course, the flu, various respiratory diseases, kidney disease, and suicide. Yeah. So these are adults. What do you think about children, like 1 to 4? You're probably not thinking maybe heart disease and cancer is up there. Right here, I'll just go ahead and show you. Yeah, and amazingly, the #1 killer of children is gun violence, is being shot, finding a gun, or being, shot. So very, very sad to talk about, but that's the #1 killer of children. And of course, since they're young, you still have cancers and heart issues, but much rarer if you look at that. It's kind of a disease of aging, but congenital anomalies, not going to kill you when you're 80, probably, right? It's going to show up early and really restrict your lifespan. Homicide, you can't even think about, that kind of, well, I'm sorry, you can't think about homicide and actual trauma, which is very sad in anyone, but especially a child. Yeah. Yep. And some things having to do with maybe they're born and there was a lack of oxygen, things like that from the perinatal period. All right, so you got the major causes of death in adults and children. Again, you have to memorize this chart, but you need to know the top ones. And then if you looked at that and you looked at 2021, you can see how fluid this can be, how things can change. And maybe another pandemic could come, but you can see at a certain time the COVID deaths overtook everything else. And so these things can change. And like I say, cancer may overtake heart disease pretty soon. And just to show you this COVID-19 pandemic again, is that this line, this red line here, shows, above the normal baseline of deaths, just to show you worldwide how many people it killed. It's like, oh, it's kind of normal to COVID deaths kind of. No, it's not. There was a lot more people died, and it's pretty clear. And in the United States, we handled it horribly. You'll see one of the worst responses among countries. And I find this fascinating. Okay, let's take a look at this. This is what actually kills you versus what people are think's going to kill them that we talk about that you're worried about, and how disparate that is. So you can see on this left-hand side are the normal causes of mortality. So heart disease, cancer, see that. But if you look at the two on the right are what is found in a couple of newspapers, just like someone did this research. You see terrorism and homicide and suicide make up vast majority that they talk about. So people worry about terrorism so much. But if you look at how many people are killed, it's this tiny little fraction down here, 0.01%. But all this attention is given to that. So we really have this disconnect. This is Google searches. Again, you can see, cancer. It's search quite a bit, but heart disease not as much, even though that's more likely to kill you. So the idea is people have that, what's going to kill me, like bear attacks. Or when I was a kid, quicksand. Quicksand was on Gilligan's Island, all these shows, and we find out in my adult life, I never really encountered quicksand. But if you looked at movies at the time, it's like, the percentage they have quicksand in these movies, and so I was always worried about that. So just to keep this in mind, that you'll see what people think is going to kill them versus the reality is quite different. And I just got, the data is always lagging a little bit, but again, heart disease, cancer, just give you, some recent things, mostly car accidents, COVID hanging around still. Yeah. All right. So that's what's most likely going to kill you. And again, when you die is interesting. That's what actuaries, people in the insurance industry are paid to figure out based on your variables when you're going to die. And, you throw smoking in there or other bad habits, reduces that lifespan. And then worldwide, I want to show you this too. Sure, we're in the US, but worldwide, you can see, again, heart disease, big one, cancer. But then you see some other things showing up you don't see in the US, including things, neonatal disorders. This is around birth. So this includes countries that don't have the healthcare that we do. And they have more, there's more infectious diseases, things like cholera. There's less access to healthcare. So, if a baby is dehydrated, there's not an IV bag available right away, things like that. So you're going to see things like malnutrition, lack of protein, armed conflicts in some parts of the world, killing a lot of people. Yeah. Mm-hmm. You see HIV/AIDS too. It was up in the top 10 in the 90s, in 1990, but today with our well, it's still a problem in other countries as much, but here not only have our therapies gotten better and our education better, so things move up and down this list. Like COVID wasn't there at all, and then it was number one in 2021. But the big killers, what's going to kill us? Your heart, and some kind of cancer will catch up to you, most likely. That's your most likely scenario. One more. I don't want to continue with this, but this is kind of graphical. It shows you, just imagine these deaths this particular year is like 500,000. And you can see the bigger the circles is what is going to kill you. So you see heart disease, cancer, respiratory disease. Yep. Your chance of dying of a muscle disorder is 162 people out of 500,000. Yep. Yeah, and so you will see things like your digestive system, genital urinary diseases, things like that are just very unlikely. It has very few deaths as we age. Our teeth, actually, periodontal disease, one of the biggest, most common diseases of aging, but it's not reported that much. It's not usually a cause of death. So, yeah. All right, fantastic. So, what about risk factors for these causes of death? You think about the heart disease, the cancer, you think smoking and obesity comes right to mind, and high blood pressure, hypertension. All those things are related to a plethora of issues that they can cause. Yeah, even smoking, you think, oh, lung cancer, you know, the deadliest of the cancers, but it also increases diabetes risk and just a whole slew of issues. You don't heal right, your immune system's not great. So, um, tobacco use, if you look at the risk factors, is number one, high blood pressure and obesity, and yeah, diet related in there too. Yeah, and I'm gonna go ahead and let you guys. I don't know. Yeah, I'll let you go ahead if you want to take a look. Great link here, um, where you can look at causes of death, male, female, and different races as well, and see the differences. You'll see those risk factors, what kills when you separate out, just instead of lumping everyone together. I'll leave that for you. Again, I'll show you a couple things with risk factors. Again, high blood pressure. And hypertension is something that's, if you have healthcare, you get it checked every time you go, right? Every time you go to the doctor, yearly or whatever you guys do, I get it checked. Imagine you didn't have healthcare. You wouldn't know you had high blood pressure. It has no symptoms until, serious issues of stroke and heart attack and these things happen. Yeah. And it's going to bring me to a point I'll talk about in a moment too, how it's much cheaper to have preventative medicine. If you just checked your blood pressure, instead of waiting until you go to the emergency room because you have a stroke or something like that. So, I mean, in terms of uh, cost is not only like um, the trauma to a person, to a family, to society, it's the cost is so much smarter if we had healthcare. People got everything checked, health and dental care, and it's much cheaper to catch things early than to deal with a major problem that built up. So you guys go to the doctor, you get your blood pressure taken, my skin look for mold, you get dermatologist occasionally, do a colonoscopy when you're a certain age, and mammography, and these things. If you have healthcare and you do that, it's just going to make your life expectancy and your quality of life much better. But you need healthcare, and there's a swath of people, especially in the United States, that don't have access, don't have healthcare, and they end up in the emergency room after it's really too late that they could have caught it much earlier. I think you guys got it. But look at that. And tobacco use, yes, horrific. It was, yeah, given out to GIs to be, it's healthy. And then we figured out that it was not. And still people smoke. So it's crazy. Yeah. Unsafe sex. Yeah. Looking at HIV, things like that. High body mass index. Yeah. Alcoholism, drug use, definitely up there. And drug use deaths in Maine have been just climbing, fentanyl, all these things. And then 2023, actually, the first time it went down, it's been climbing ever since, like 2018. And then there's some cause for hope there. Yeah, and iron, zinc, vitamin A. We're talking about, lack of vitamins here. And in other parts of the world where you have a diet of just rice, you just don't get that vitamin A and you have blindness, all kinds of issues. So this is worldwide. Yep, and finally looking at this, just ranking them as risk factors for these things that are going to kill you. And you can see there's behavioral risks, such as your diet and smoking and alcohol use, child malnutrition, behavioral risk. Wouldn't think so. I guess, yeah, confused by that one. And then metabolic risks, yes, having high blood sugar and being obesity and high cholesterol, indeed. And then environmental risks. Yeah, I'm here in Maine, we have beautiful air, but if you live in Beijing or even Los Angeles, a lot of places are just unsafe to be outside a lot of the time. and take that for granted, being the Northeast, having some beautiful air. All right. Okay. So, mortality is lethal. These are lethal diseases. Talking about heart attack, cancer at a certain point. But how when you look at it like health overall, if you're just looking at that's the health of the society. I mean, just looking at mortality seems so such a blunt way to look at it, right? What about the overall health? If you have, deaths, what about people that live with diabetes and disabilities? All these things is something to look at. And so how are we going to get at that? Like you can look at disability, like people that apply for disability benefits because they can't work, that kind of thing is one way you can kind of get at it. And people define disability so differently, don't they? Yeah. We could look at, why do people go to the doctor? That still just catches that slice of people with healthcare, right? Those without healthcare can't just go to the doctor. They can't afford it. So they end up going to the emergency room at something that's acute. I mean, it could have progressed to that. But looking at office visits at hospitals, you can see this is listed, ranked. The most common reason we're talking about people have kids and they bring them to the pediatrician to talk about immunizations and health, make sure everything is just fine. We care a lot about those little buggers. So we go often early on, parents to make sure everything's okay. So, so this is not even, and then checking high blood pressure is number 2. A lot of people on medication and they go to keep their hypertension in check. So these 2 things aren't acute injuries, or really, they're just preventative. Taking a look at that, aren't they? Yeah. But finally, we get to most common really up here, certainly disease here, is looking at the cold, common cold, looking at respiratory infections. Could be strep, could be cold. But really, it's nothing you can do for a cold. It's self-limiting. There's no long-term effects. Cold is just living with us. So it's just time and rest that will make you feel better. So it's not even necessary to visit the doctor, but we don't know. It could be something more serious that we want to find out. And then you get to some long-term things like arthritis and diabetes, where people with these conditions, it's chronic, lasts for years and decades, and they come, to check, in this case, glucose levels and look at their metformin or whatever kind of drugs they're on to see if it's working properly. And then, of course, back injuries. Us humans, we have all kinds of back issues and other spinal issues. Yep. And then procedures. A neoplasm is cancerous or some kind of tumor kind of thing. Of course, a lot of pregnancies. So most people go to the doctor for that. Yep, get your gyno exam, ear infections. Yeah. So why do people go to the doctor? I want you guys to know. Mostly it's kids going to get checked out, but then things like high blood pressure and diabetes, a lot of office visits in order to manage those long-term diseases. And then colds. All right. So what is the effect of a disease on a population? Indeed. And this is what I already mentioned to you, that it's expensive to be poor. Indeed. It's those, preventive things like the flu shots and being able to go to the dentist and I go, every 6 months and get my teeth cleaned. And if you're poor, rural, inner city places that you don't have that, right? And you're going to have all these things build up, and then it just gets bad. So we really need everyone to have access to preventative care. It's cheaper in the long run. It is, right? Indeed, if you don't have health care, unless the doctor visits are free, you often can't go if you're poor. All right, we're going to talk about, I see down here, mortality. We can easily look at mortality rate. It's usually how many people die per 100,000 a certain disease. And we'll look at morbidity, how many people maybe get sick at a certain time period. Or if you look at a population, how many people have diabetes, something like that. So get to some terms here. And again, I'll leave you one more time with this, with poverty and health, and just so you really appreciate this. And it depends. Our backgrounds. I don't know. I don't know you, but if you have come from a background where healthcare is just taken for granted, where you have parents that have a certain job that comes with healthcare, and they get it for their children, and so I'm sure for many of you, you grew up with dental and healthcare. And some maybe not. I don't know who I'm talking to here. I'm talking to my computer, actually. But I want you to all to appreciate this, that if you don't have the resources to get regular dental and medical care, you're going to get sick. I mean, you're not going to catch it early. You're going to get sick enough so that often you're disabled, then you can't work, and it's just a circle. And so it goes back where you didn't have preventative health care, you get sick, then you can't even make money even to get health care. And it's just, you're trapped like this. I have one more like this so you can see. And you can think also worldwide, but in the US too, there's a huge amount of people without healthcare, people of poverty that go to children that go to bed without having a meal. It's not, I mean, we can, maybe you don't see it, but it's, it's there. Yeah, poverty and health are inextricably linked, indeed. If you're poor, your nutrition, you're eating, you see some places you don't have fruits and vegetables. You have Cheetos and frozen meals. If that's all that's in your local, if you're shopping at 7-Eleven instead of like a organic, the farmer's market. Think about, the difference here, and how more expensive it is to buy salad fixins than a frozen dinner, right? So poverty related to nutrition, and then, lack of clean water and sanitation. Yeah. Yeah. And taking jobs and doing things that are risky, but you need to do it in order to make enough money to keep your family alive. So you put yourself more at risk, do more riskier jobs. Yeah. Indeed. And of course, whenever you look at wars, disease follows when infrastructure is destroyed, etc. All right. Well, let's see here. Looking at this and looking at healthcare all over, you see in here, this is showing. I just found a couple things online looking at performance in healthcare, and we're looking pretty good in the Northeast. You can see the bottom, the darker it is, that you're in the bottom of how they've ranked healthcare, and so you see large swaths of the South. And again, some of this is political. It's like, what is it worth, putting your money into, yeah, a lot of it's political, but, and you can see some good places where there's how they rank it as better performing healthcare. But indeed, rural hospitals closing. Yeah, and then when your nearest hospital becomes 100 miles away and you can't drive, these things are just kind of spiral down. Yep. And this is where uninsured people are. You look here that the darker is uninsured. I think it's done by county. Yep. And if you look at Maine in particular, I see it's less healthcare down east in some of the northern parts. And you look at socioeconomic factors, of course, you have richer, more educated around the coast in Portland, and you'll see they have jobs that provide healthcare. And if you're working for yourself, or you're I don't know, lumberjacking or potato, whatever you do that is not something that provides healthcare. I mean, if you make enough, you can buy healthcare, but if not, you have to go without. So you can see, looking at Maine right there. But then other states have very low uninsured, which is beautiful. Yeah. All right. So how are we going to measure this ill health instead of just, causes of death, right? So you can look at disability. And as I mentioned, there's various definitions of disability. But if you have a heart attack and afterwards you have depression, you're not able to walk upstairs, maybe you can't work. Maybe you have a stroke, you're bedbound, or you use a wheelchair. It's going to, affect your life. It's going to make you disabled, not able to do things that you could do before. And we call, when you look at this morbidity, which is not mortality, but some kind of disability, it's called morbidity. It's the frequency of this disability in a population. And let's see, when you look at this, arthritis and then back issues. Of course, we have all kinds of back issues and spine issues that keep people from living a normal life. And again, cause of death would maybe a heart attack, but even if you survive this heart issue, you could be disabled, not able to do what you used to do. Cardiac muscle doesn't, heal that well. And look at, yes, mental, emotional issues causing disability, unable to work, unable to do things that, that they used to be able to do. Mm-hmm. And when you look at the healthcare costs, and some of you may think, well, you're talking about money, Parmalee. That's not important. What's important is how people are healthy. Okay. But there's only so much money available. It's going to be how much we can, how many people we can reach. And I'll tell you this right now, we spend an extraordinary amount of money, millions and millions of dollars on individuals that possibly without much benefits. Okay, so there are just small percentage that extremely complicated cases that we put millions and millions and millions of dollars into, and also end of life. And again, I don't want to get into this too much, but when you ask, when someone is, when you ask a family, when you ask a doctor, or when you talk about how would I say this, but when you think about that time, at what point is it, do you want to keep keeping a person alive, even though they have just no chance of coming back? And of course, we just, in many cases, people say, just do anything and anything to keep them alive. I can't be responsible for pulling the plug, etc. But this is a big issue, ethical issue, that I'll just put out there is when you look at end of life care. And some of you maybe are interested in that. Others don't want to talk about it. But in many cases, I mean, I personally feel that we should make some smart choices of the patients and the family what is best overall. I guess I'll say that. But cost-wise, direct cost is how much are the drugs? How much did that procedure? We have to pay the anesthesiologist, all these things. But the indirect costs are the disability, the not being able to go to work. Besides dialysis, paying for insulin pumps, all these things are the indirect costs that add up. So when we look at healthcare, and the United States pays more for healthcare per person than any other country, and we don't have the best healthcare. So, okay. Okay, so some terms you need to know. Frequency is going to, usually that's what we use, and it talks about, in 1 year, what's the frequency of appendicitis in Maine or something like that, right? Interesting here, looking at, this is people come in for like flu, you can see that it peaks during the winter months. Of course, people are indoors and more likely to spread. So you can look at frequency changes for diseases like COVID and influenza, whereas less in the summer when we're outdoors and not as close to people. But yeah, we look at impact of a disease. What is the frequency of this disease in the population? So how many have it per 100,000 or per million? But here, I want you, these are some terms that maybe you need to pay attention to here that you don't use as often. So the incidence is the number of people that get it per time. So it has to be defined. So UTIs, broken arms, colds, how many, you look at a population of 100,000, how many people get it? So that's one way of looking at it. Now, that's good for things that are acute. Notice that they come on and you get rid of them. Prevalence is a way of looking at a population and saying how many people, what percentage of the people have this disease. And that's much more important for things that are chronic, like diabetes, hypertension, or cancer, Alzheimer's. What is the prevalence in a population? Okay, so these two things are different, and they're used. You should know incidence is for things that are acute, that happen, go away, and prevalence we look at. What is the burden? How many people have it in a population? Okay, yeah. Let's look at incidence. I like this little bathtub here. Yeah. And so prevalence, these people with these chronic diseases, either they're going to die and they leave, or they get cured from it and they leave this particular population, or they continue to have it and they're still counted in that prevalence. I see this thing here is HIV cases. Look at different years. Oh yeah, so you can see the incidence, the new, those are new cases, new diagnosed cases. Indeed. And then, I'm sorry, get that backwards. Yeah. So you can see the new cases actually come down, and people live with it for a long, long period of time now. And so that's looking at prevalence, is how many people have it. Incidence, how many new cases are reported. All right, you guys got it? All right. Mortality rate, I think it's pretty straightforward. Number of people that die, you have to say per week, per year, something like that. You hear about survival rate, you look at that, pancreatic cancer, average like 18 months or something like that, as opposed to prostate cancer, where it's much, your survival rate is much more likely. And the prognosis is the outcome. What is your prognosis is saying? What is the likelihood that you're going to continue to have this or to die? Brain cancer survival rates. Yeah, survival and time since diagnosis. So you can see here is where people are diagnosed with brain cancer. And then you look in the years beyond, and you can see that only among the very young, the black line, well, I guess others too, where survival rate is better. And if you contract it later in life, like the pink line is the oldest population, you're much more likely to die earlier. Your prognosis is worse. Yeah, so in many ways, look at this epidemiologists and people that look at disease. You have to be good at math and good at statistics. It's interesting stuff, though. All right, so acute diseases, you can see most are going to be you have a cold, right? Cold, flu, things like that, absolutely. And then injuries, mostly car injuries, but falling off ladders, trampolines are really bad, all kinds of things like that. Yeah, and then the rest are going to be some all kinds of other, some other disease, something that you're going to get. Yeah, indeed. Yeah. And you see acute illnesses, things like this in the young. And as you get older, you get more chronic illnesses. And so something that's kind of interesting is that when we get older, we see more diseases coming about, right? Old people. Yeah. And some of it is wear and tear. You build up things in your cells, and your telomeres get shorter. You have less ability. Your immune system is worse. Your homeostasis is harder to control, etc. But I just want to mention this, that there are diseases that occur after, when you're older, they are not selected against by evolution. Let's think about this. If you have a disease that kills you when you're 5, 6, 10, 14 years old, 20 years old, that's going to be selected against. But if you have a disease that doesn't come out until you've already passed childbearing years in your 50s, you've already had your kids. They all have your genes. So the diseases that happen, genetic diseases that happen early in life, are those that are rarer than those that happen after childbirth. Because if you're 60, you realize you have a disease, Huntington, some kind of disease that appears later in life, you've already passed those genes on. So there's a lot of selection towards diseases happen later in life because the population can't select against that because you've passed on your genes and you didn't know you had that issue. So once we're past childbearing years, your body's like, evolution is like, you can't use me anymore. Chronic diseases. So as you get older, chronic diseases just start coming, right? They come fast and furious as you get older. Things start going wrong. And these 70% of US deaths, 3/4 of our medical care costs are for dealing things, Alzheimer's and long-term cancers, things that are chronic diseases, take up the bulk of our healthcare costs. It's not broken bones or appendicitis or burst spleen, things like that. Yeah. And as I mentioned, periodontal disease. We're talking about your teeth. And as you get older, look at a third of people in that age range. And as you go up, it even gets crazy. It's just so common. Your teeth, the gums, teeth fall out. You have issues. Yeah. Mental illnesses, chronic mental illness. Yeah. And then we'll see with age, back, cataracts, arthritis, these things add up. And some things that are actually equally, they're not just elderly. And then some cancers like testicular cancer is a cancer of young men usually, and prostate cancer is of old men. So it's you're going to see things that differ like that. But something like bronchitis and asthma, it doesn't have really an age relation, but most diseases do. They increase with age. Life expectancy. Well, here's going back just to 2008, and you can see if you were born in the 20s, you expected to live 55 or something. Born over here, you're getting in the 70s, 80s. I'm showing you that. Oh, isn't that nice? But then I'll show you this. Just, I was reading about this to see that we've actually taken a dip, worse than other countries. So you can see the United States, you think, oh, we're the best in everything. Not in healthcare, not in life expectancy. Yeah. We don't have universal healthcare. We have healthcare for some. And what we have here is this increase, we've lost it all. It's already come down. And all this is COVID related. Part of it is that caused this big dip right here in life expectancy coming down. But you can see, we were going up and then we've come all the way back down again. And looking at peer nations, we're looking at other richer countries, you can see we spend the most per person. 13 grand almost per person in 2022. And yet we do not have the best healthcare. There's a whole, it's for profit here. There's a whole, people take the money at many, many levels, and insurance companies, all this. So it's a whole other discussion here. Life expectancy worldwide, you can see that the dark purple and blue is the longest. So many countries, their lack of healthcare, there's other bunch of diseases, tropical diseases that like that, Mongolia, I'm sorry, here, talking poor nutrition, Papua New Guinea, looking at some Central American countries. But longest life expectancy, Canada over the United States, and countries in Europe, Australia, Japan, New Zealand. You think it's related to access to healthcare. And then looking at men and women live longer. They do. Why is that? You go to old folks' home, it's mostly old women versus old men. And men smoke more, drink more obese, less likely to seek medical help, do stupid stuff. I'm saying this as a guy. So all these things go into this, that women have a longer lifespan. Aging, like I say, that is the biggest chronic disease, is getting old. And something's going to kill you, right? No one's living to be 130, right? And progressive irreversible disease, if you want to call it that. And people look for the fountain of youth, and we have not found that. And so the main thing that has caused life expectancy to go up is not artificial hearts and gene therapy. It's basic sanitation, preventative measures, vaccines. Sounds simple, but that's what really causes our life expectancy to go up. Because in the old days, children would die of diarrheal diseases, of measles, things like that, that we've conquered that. So if it's very unlikely you're going to die early in life. But yeah. And the longer we live, the more chronic diseases we're going to see. That's why you're going to see more cancers, more Alzheimer's as the population is ages. Yeah. And aging begins, you guys have already started it. Once you hit puberty, your late teens, 20, then the aging process, everything, your lung capacity, your brain is less of it, your less muscle mass, more fat. It's just everything starts there. Yeah. And as you get older, increased susceptibility to disease. Very true. Your immune system is not what it used to be. And many issues here. Mm-hmm. And looking at what age-specific death rates, so you can see here that there's childhood death, but then you're very unlikely to die until you start getting old. And then when you're old, every year, there's a much greater chance of dying, isn't there? Yeah. And it kind of zooms in on this, and you can see around childbirth, if you're going to have a congenital disease, it's going to kill you that first year of life. But once you get past that, you're doing pretty good, as you're unlikely to die until you see it to your 40s, 50s, 60s, and then every decade beyond, much greater chance you're going to die that decade. Percentage of deaths in Canada, taking a look, 1921, 66, and 2011. Cool. So you can see in 2011, oh yeah. You can see why. Well, the maximum lifespan hasn't changed much. How long the oldest person, but how long you're going to live on average does. Yeah. Very cool. Each unlikely to die again when you're young, but when you get older, chances are good. Yeah. And so what causes aging? A friend wrote a book on aging. Herpetologists looked at, how turtles and crocodiles, they live very long time. And why does mice, why don't they? And why do we live at a certain age? And there's no simple explanation, but oh God, this is so much I want to say, but your idea that your cells only divide so many times, we build up junk in our cells, that all these things lead towards aging. Yeah. Now, there's age-dependent diseases are things that as you get older, these things kind of go bad. So some osteoporosis, presbyopia is your eyes, you need to like wear your readers, and then changes in endocrine, and hyperplasia is growth of could be benign tumors or prostate kind of enlarging. So these things happen to everyone. These things kind of are going to kind of happen. Your joints, just osteoarthritis happens. Just your joints the cartilage gets worn out. So age dependent is just everyone has these. But age related diseases means that you get more old people get it, but not everyone is going to get it. See what I mean? So similar, of course, yeah. But yeah, and as you can see, Alzheimer's definitely you get it in older age, but not everyone is going to get it. Some people don't get it at all, right? They die without any mental issues at all. So, and some of these cancers, etc., that it's related to age. You get it more likely when you're older, but it's not age dependent as before, that everyone has this wearing down. All right. And as you get older, I think I'm just about done here. All right. Your immune system is just not as good as it is. And as a pharmacist, when you give drugs, you want to know what's the age of the patient. Is it geriatric? Is it a petty, young person? To see how those drugs work, how they're broken down by the kidneys and the liver, because that changes throughout age. Yeah. You see diabetes increasing as you get older, big time. You lose especially the gray matter in the brain. Your bones get less dense. You have less muscle, more connective tissue. And the number one system is your skin, really, that changes with age. You don't make the collagen elastic. You have less fat, so your wrinkles appear. Your hair, gets lighter, things like that. Digestion, I mean, your teeth are the main problem. And before we had dentures, things like that, people would die if you don't have teeth. You can't chew your food. A lot of animals, like an elephants, when they get old, they die because their teeth are all gone. Or a horse, the teeth get all worn down too. But in us, it happens, but it's not really going to kill you here. And you have more like constipation and digestive issues, but a lot of systems in humans, you're not going to notice a problem as you get older. Yeah. I mean, you can't run a marathon anymore. It's harder to get up out of a chair. Some things like your joints and some things you notice, but your kidneys, your digestive system, you don't notice really changes with aging, most people. Ah, beautiful. All right, everyone. Quite a lot to talk about, but I hope you got it. You got some terms down, some terminology. So no age dependent, uh, which is age-related disease, no difference between prevalence and incidence, and then be able to tell me the major causes of mortality or death and morbidity, why people go to the doctor. And again, our average age lifespan is going up, although I told you in the US it's actually come back down a little bit, average-wise. And that's causes of death and morbidity change throughout your lifetime, right? From young to old. All right.